So what actually gastro-esophageal reflux disease is actually reflux, actually a stomach content reflected into the esophagus that can cause symptoms such as heartburn, regurgitation, as well as other symptoms like dysphagia, asthma-like symptom, coughing, all that. These two symptoms like heartburn and regurgitation is usually caused by what we call this defect of the lower esophageal sphincter. Usually the food goes from the esophagus to the stomach. It's actually a one-way direction. If in normal person there is actually a transient esophageal reflux sphincter, whereby the food content sometimes goes up into the esophagus, but it doesn't cause much of the symptom. In the gastro-esophageal reflux disease, the transient esophageal reflux, transient esophageal sphincter relaxation is a bit more. So this actually can cause more reflux. Apart from that, there is also what we call a defect at the diaphragm. So there is actually a big opening. So sometimes this defect actually cause what we call part of the stomach goes into the thorax. So this also can actually promote more reflux. Apart from that, other pathophysiology of the reflux disease is because of the delayed gastric emptying time. So this can be caused by certain disease like diabetes, all that, on some medication. So this actually cause what we call delayed gastric emptying. So that one also can actually promote reflux. So apart from that, so what are the investigation that we will do? Usually based on the symptom, we can actually make a diagnosis of reflux disease. We can actually make a diagnosis if you give some medication for the patient. If we suspect the reflux disease, the symptom of the reflux will reduce. So we can safely diagnose based on the symptom. But if let's say patient presented with reflux symptom at the later stage, I mean at the age of 50, or there is an alarming symptom like loss of weight, loss of appetite, dysphagia, difficulty in swallowing, sometimes because of bleeding or vomiting blood or passing of black color stool. So we need to do a upper endoscopy examination to look for any evidence of complication of the reflux, such as bleeding, stricture, Barrett esophagus, or malignancy. Once you make a diagnosis or see whether there is any complications, from there you can treat the patient accordingly. Other modalities for reflux disease, we can do esophageal manometry and what we call this pH monitoring. So these are the gold standard to make a diagnosis of reflux if you can't make a diagnosis before.